Every 3 minutes, somewhere in Africa, a child dies of malaria. This deadly disease is caused by a parasite transmitted through mosquito bites.
This parasite is known as Plasmodium and has a lot of species. But out of these species, 4 of them cause malaria. Plasmodium falciparum, the one that causes the most difficult or malignant disease because it destroys both young and old red blood cells. Plasmodium viva, Plasmodium ovale, and then Plasmodium malaria. But there's a 5th one known as Plasmodium knowlesi.
Malaria is totally curable and can even be prevented if we keep our environment and surroundings clean. In addition, we should also use long-lasting insecticidal nets around our beds. And when symptoms arise, do not panic. Get tested by using microscopy or rapid diagnostic test kits, RDT. If tests are positive, treat the malaria with artemisinin-based combination therapy, ACT. Since 2009, the Family Care Association and the Nigeria Malaria Control and Prevention Program, NMCPP, in partnership with the Federal Ministry of Health's National Malaria Control Program, have made concerted efforts towards the control, prevention, and treatment of malaria in Nigeria. Family Care Association, a faith-based NGO, has been working in 7 states across the Federation. These are Imo, Ondo, Akwa Ibom, Delta, Lagos, Cross River, and River states. This program has supported the eradication of malaria primarily in rural communities, distributing free, long-lasting insecticidal nets, LLIN, rapid diagnostic testing, RDTs, free treatment with ACT medication, and intermittent preventive treatment, IPT, for pregnant women.
The point that every one of us can have malaria, but children, especially children less than 5 years old and pregnant women, are at a higher risk of malaria.
Right now, Family Care is providing training, and a lot of this training they have been doing in the past 1 year has been tailored towards having to build up the health staff and the community in terms of awareness, in terms of current trends in malaria control and prevention.
Health workers, community agents, members of religious institutions, students and teachers have also received training in malaria control, prevention and treatment from seasoned medical experts.
The training is meant for healthcare providers at primary healthcare level. We know that primary healthcare is an essential healthcare that brings a healthcare delivery as near as possible to where people live and work. And then using the technology that is within them, around them, delivering this healthcare in the language that they will understand with their own full participation for self-reliance at a cost that every member of the community will be able to afford, and at the same time promoting health in terms of health promotion, health in terms of curative or preventive and of course rehabilitative medicine.
They have been able to train health workers in Eastern Obolo, Urefong Oruko, Esreket, Eket, Nsurubium, Ikotekbene, Ibesikbo, and Eastern Obolo. They have been able to train the health workers there, and they have been able to reach out to over 500 community members where they have been tested of malaria and being treated.
Statistics show that 97,770 LLINs have been distributed. 5,759 community health workers have been trained. 137,318 teachers, students, agents, and indigents have also been trained in malaria control and prevention. While 25,117 people have received malaria screening using RDTs, 9,942 patients who tested positive were treated using ACTs. In addition, 4,000 pregnant women were treated using IPT.
In a place where we went to, somewhere in Ondo State, the Ondo West local government precisely, the malaria prevalence in that area was as high as 78%. But on returning 3 months later, the malaria prevalence dropped to as low as 20% because those members of that community implemented the preventive measures, including the use of long-lasting insecticide-treated net.
We have really appreciated their coming because they have displayed, and of course, they have done so many things that we never expected. Like, look at some drugs that they have distributed we have never seen, and they have gone very far, mobilizing the community, giving the awareness on the use of, most importantly, the RDT, which is very important, the machine that is used in testing the malaria parasite.
In fact, I'm very, very impressed because most of the things I did not know, I have known today.
The theme for World Malaria Day 2013 and the years to come is Invest in the Future, Defeat Malaria. The goal is energized commitment to fight malaria. Our world can be better and happier if we can maintain and accelerate progress in the eradication of malaria in line with Millennium Development Goal number 6. Reduction in malaria also contributes to the attainment of MDGs 4 and 5, which focus on infant mortality and maternal health.
Women, especially pregnant women and children under 5 years, form the bedrock and foundation of any given human society. And malaria targets this particular population group.
Statistics have shown that over 300 million people suffer from malaria every year. And then when we look at death from malaria, we are looking at over 500,000 people dying from malaria every year. It was also shown that every 45 seconds in Nigeria, one child dies from malaria. And so when we are looking at it, it's something that one needs to really champion to see how we can reduce this burden. And this burden includes disease itself, which is the morbidity, and then reducing death, which is mortality from malaria.
More investment from government, corporate bodies, NGOs, and philanthropic individuals is urgently needed. In our fight against malaria, we must place special emphasis on the protection of the most vulnerable groups, specifically pregnant women and children under 5.
Malaria is a deadly disease and it's very dangerous. It affects children a lot and pregnant mothers.
Failure to take action against malaria now poses a very real threat to the survival of our society.
They have really helped us in the malaria unit to move the war against malaria forward.
I want to thank them for all the effort they have put in having to fight the scourge of malaria.
We say thank you for this thing you do for us because now don't make us today happy.
I appreciate what they do.
We remain very grateful for giving us these mosquito nets, which will go a long way to help our pregnant women and children from premature death. I say thank you very much.
The fight against malaria needs everyone's commitment and involvement. So do your part. Invest in the future. Defeat malaria.